Hi, my name's Diane. I'm an orthopedic nurse at Central Maine Medical Center for the Orthopedic Institute. I would like to talk to you today about discharge instructions. So if you have had a total knee replacement, total hip replacement, total shoulder replacement, there are a lot of similarities on the discharge instructions. So let's go down through the basics of them today, and we will hopefully answer any questions that you have individually, either with a phone call or with your nurse. Thank you. So the first one is to journal your activity the first week after discharge. Journaling your activity is going to do two things for you. The first thing is it's going to help you as a patient be able to look back at your journal and keep on track with your walking program, your icing program, your medications. But the journal is also a big help for your family members, your coach, your support system. It will allow them to look at your journal and help keep you on track so that you avoid any complications after surgery. So journaling is as simple as a notebook, a piece of paper, a spreadsheet, whatever you want to use. But if you track all of your activities, so your walking, your cold therapy, your medications, your bowel movements, when you go to the bathroom and urinate, all of these things will be helpful for all of your team. So the first thing that we're going to talk about is walking. So walking is really important in your recovery. It helps prevent blood clots. It reduces your swelling, which in turn will reduce your risk for infection and reduce your pain. So your walking hourly throughout the daytime hours is going to vary in the distances that you walk depending on how you're feeling. So 1 hour you might be feeling great and you want to get up and do a long walk. The next hour you might be tired and you might want to just get up, go to the bathroom, go to the kitchen, get a drink, and then go sit back down again. So the goal is that after you're done your hourly walk that you will pay attention to your lungs, because after surgery your lungs are always at risk for an infection. So if you would sit or stand and do 3 big deep breaths and then a good forceful cough, this is going to help remove the secretions that would like to accumulate in the bottom of your lungs and cause an infection. So for the first week after surgery, pay extra attention to your lungs after your walks. The second thing we're going to talk about is to remember to use some sort of cold. So total shoulder patients, total knee patients will be going home with a cold compression wrap. This is a black Velcro elastic wrap that can be used technically 24 hours a day if it's comfortable and you feel that it's helping you. But the manufacturer asks that you do not change the ice inserts any more often than every 4 hours. So this is important because the ice inserts will come to room temperature about 2 to 3 hours after they've been removed from the freezer. We do not want your new surgical area cold all the time, because cold actually would increase your risk for infection because it's reducing the blood flow, and we do not want to delay your healing by reducing the blood flow. So it's a balance between cold and room temperature. So if you choose to use the inserts, just remember every 4 hours, no more often than that, change out the inserts. If you don't like to use the compression wrap, you have the option to use anything else that's cold. Some patients have said they use a bag of peas, a bag of corn. So anything that you want to use that's cold out of your freezer is absolutely okay. But then your instructions would be to use it no more than 20 minutes every hour. So again, that's to keep the balance between cold and room temperature. So number 3 is talking about laxatives and stool softeners. So your discharge instructions when you go home today will say, generically, go home, take 1 tablet of Senna twice a day. So if you go home and just stick to those instructions, sometimes it's difficult to get your bowels to wake up after surgery. So you can always ask your pharmacist for help with what to take, how much to take, but the goal is that you will get your bowels to wake up in the first 24 hours that you're back home in your own environment. Don't forget to eat and drink whatever typically is helpful in getting your bowels to move. So your fiber foods, your prune juice, prunes, raisins, nuts, Be creative. Whatever makes your bowels move, make sure you include it in your diet. So I would like to share with you just a small fact about medications for your bowels. Laxatives are a medication that get your bowels to move and squeeze. Stool softeners are a medication that soften your stool. So if you go home and you only take a stool softener, you are making your stool soft, but they don't have the squeeze to get them to come out. So please remember to use laxatives and not just a stool softener. Number 4 is talking about blood clot prevention medication. And again, in a group setting, and the generic instructions, all patients having a joint replacement will go home on some form of a blood clot prevention medication. But I can't say specifically what you're going to go home on. But I can tell you that the side effects of all the blood thinners are that they thin your blood to the point where you might see blood in your urine or blood in your stool. So while you're on a blood thinner, I would like you to get in the habit of looking in the toilet bowl before you flush it. If you see pink water after you have urinated, then you need to call the surgeon's office at Central Maine Orthopedics and report that. And the same thing with your bowel movements. Another symptom that your blood might be getting too thin is excessive bruising. So if you bump up against something and then you see that your arm is, all bruised, then you'd want to report that to the surgeon's office as well. So just be very aware that when you're on a blood thinner, the goal is that it's going to prevent a blood clot, but it does have risks with it as well. Number 5 is talking about acetaminophen. So most patients go home with the instructions that we would like you to take acetaminophen, which is Tylenol, 650 milligrams, which is 2 regular strength tablets, 4 times a day. A common error for patients is they take 4 times a day and they flip it to every 4 hours. So just make sure that you understand that it's 4 times a day, and we want it to be about every 6 hours apart, but we do give you some room so that you do not have to get up in the middle of the night to take your acetaminophen. The other part of number 5 is talking about narcotics. So you will go home with some form of a narcotic. The most important thing I could share with you is that the narcotics that we send you home with are not extended release. So why is this important to you? Because your instructions on how to take those narcotics will typically say you can take 1 or 2 tablets every 4 to 6 hours, as needed for acute pain. You do not have to take 1 or 2 tablets. If you only need a half a tablet, then we would want you to use just a half. If you only need a tablet and a half instead of 2, I would want you to use a tablet and a half. Why do I want you to use the least amount of narcotics to keep your pain tolerable? Because of the side effects that go along with the narcotics. So narcotics, just some overall side effects are that they make your brain a little foggy and forgetful. They will alter your taste buds, so your favorite foods won't taste well, and they alter your appetite, so you will not be hungry. We still need you to eat good nutrition after surgery. I would like you to focus on calcium, vitamin D, protein-based foods. So just be mindful that if you don't have an appetite, the narcotics are probably the reason why. They also will make you nauseous if you don't take them with some food before every dose. So the best food to take your narcotics with is typically protein-based foods. So yogurt, cottage cheese, peanut butter on crackers, that's going to help compensate for you being able to tolerate them without getting sick to your stomach. Another side effect is that they will decrease how many breaths a minute you take, and they also will reduce how deep you breathe. That's why coughing and deep breathing is also important. They also reduce your blood pressure. Your blood pressure will sometimes be low when you're taking narcotics, and they also slow down your heart rate. So that's just some of the effects that they have on your body, and then as we go down your body, they cause constipation and they cause urinary retention. So with all of that being said, that's why I would rather have you take a half a tablet versus 1 tablet of your narcotics. Your narcotics that you go home with are available for refills if you call the surgeon's office. So Central Maine Orthopedics in Auburn, you call them directly at 783-1328 and ask for a refill of whatever you're using. and the staff will usually turn around and get that filled for you within 24 hours. One reminder I would like to give you is that Central Maine Orthopedics does not do refills on nights. They will not do narcotic refills on weekends, and they will not do them on holidays. So before the weekend, maybe Thursday night, I'd like you to do a pill count, see how many tablets you have left, look at your journal, and then see how many you've used in 24 hours, and then make sure you have enough to get through until like Monday afternoon. If not, please call the office either Thursday afternoon or Friday morning to make sure that that refill gets sent before the weekend. Number 6 is talking about your dressing, your bandage over your incision. This is a special dressing that has silver embedded in it. Silver is an antimicrobial metal that helps prevent infection, and it also speeds the healing process. So the goal is the bandage will stay in place, whether it's your shoulder, your hip, or your knee, for the duration until your first follow-up visit. This is typically 10 to 14 days after your surgery date. The dressing itself will absorb a lot of drainage before it needs to be changed. So the manufacturer has shared that the dressings can stay in place unless 3 out of the 4 corners are filled with drainage. If you see that your 3 out of your 4 corners are filled and it does need to be changed, please call the office in Auburn, Central Maine Orthopedics, and just share with them, and they'll give you a date and a time to come in and have that bandage changed. The bandage itself is also water resistant, so you are able to shower whenever you feel safe to do so. I recommend that you have someone with you the first time you do your shower, just as a safety net. It's also a good idea to have a chair close by your shower. In case you do get dizzy and lightheaded, you have a safe place to sit and not fall. Number 7 is talking about going home tonight. So today is your day of discharge, and this evening we recommend that you get up once during the night and see if you need to take some medications. If your Tylenol is available, you might want to consider that with some food. If your pain is elevated and you think that you need to take a narcotic, it's safe to take your Tylenol and your narcotic at the same time. In fact, if your aspirin fell at that same time frame, it's safe to take all 3 of those medications at the same time, as long as you're taking them with some food. So you're going to set your alarm clock tonight for between 4 and 6 hours after you go to bed. I would like your coach to get up with you and give you some safety reminders. Your blood pressure is low because you've been sleeping. Your blood pressure is low because you're taking narcotics, or you still have some of the medications from the operating room in your system, which lower your blood pressure. So when you wake up in the night, I'd like you to sit up on the edge of your chair, your bed, whatever you were sleeping on, and sit there for at least 1 to 2 minutes. This allows your heart to get your blood pressure up so that when you stand, you should not be lightheaded and dizzy. So after you've sat there for a few minutes and you're not seeing any symptoms of low blood pressure, which would be, sometimes patients will say they see spots, stars, floaters, people call them, or sometimes their head will feel a little bit floaty, or some patients have said it looks like the shades are shutting. So if you have any of those symptoms, please lay back down again, wait a minute or 2, and then sit up. The second time, your heart has usually had a chance to get your blood pressure up, so you will not see those symptoms the second time. Now the next step is going from sitting to standing. You change positions again. The same thing happens with your body. So your blood pressure will drop because you changed positions. I would like your coach to just encourage you to stand still next to whatever you just got up from, whether it's a chair, recliner, your bed. And then if you have a walker, an assistive device, crutches, have that ready, use it, and then just kind of tread in place for a few minutes, and that helps get your heart rate up, which is in turn going to get your blood pressure up. If you start to see those symptoms of low blood pressure, I would want you to sit back down and wait a minute and then try it again. So this is going to help keep you safe so that you don't go to the bathroom quickly and possibly pass out before you get into a safe place to sit down and lay down again. So once you've woken up, you've done these safety checks, then I would like you to go to the bathroom. We've given you a lot of IV fluids, so most patients do need to urinate in the middle of the night. I would want you to go for a short walk, maybe go to the kitchen, get something to drink, get a snack, either some yogurt or cottage cheese or the peanut butter on crackers, and then take what you need for medications. Knee and shoulder patients with those special compression wraps, if it has been 4 hours, you're able to change out those inserts. So do that before you go back to bed. And then my hip patients, I would encourage you to ice for 20 minutes before you go back to sleep. This will set you up for success the day following. So please be safe, but please get up once in the night. Number 9 is talking about what to expect. And I myself have never had a total joint replacement, so all the information I'm sharing with you is from other patients who've had these procedures completed. So total shoulder patients, you can expect to have pain, swelling, and bruising around your bandage where the incision is. It can radiate to the back. You'll have bruising underneath your armpit that can go down to your elbow. And then the swelling itself, you're going to be in a sling with exception of bathing, dressing, and doing your exercises. And the position of your sling will allow the swelling to come down and go all the way to your fingers. So it's not uncommon for shoulder patients to say that their hand is swollen. So I would encourage you to do your exercises as instructed by the physical therapist. This helps move fluid out of your arm so that it will be more functional for you. Total hip replacement patients, patients have reported that they have pain, swelling, and bruising around the incision itself. Sometimes towards your buttocks will be painful as well, and inside the groin of your operative leg is often painful. The bruising will start up around your hip area, and because of your walking program hourly throughout the day, the bruising and the swelling it's not uncommon for it to go all the way down to your knee. So knee patients, same thing. You're going to have pain, swelling, and bruising around the incision and the actual replacement of your knee, and then you're going to have pain, swelling, and bruising around the thigh area from the tourniquet that was used in the operating room. The tourniquet did a fabulous job preventing blood loss, but it also caused some soft tissue damage around your thigh and your hamstring. So you can expect bruising to start in that area, and then it will also go all the way down. Sometimes patients will say it goes to their ankle. Other patients will say it's gone all the way down to the arch of their foot. If any of you ever have a concern, whether this is normal pain, swelling, bruising, warmth, or if you might possibly have a blood clot, which the indicators are increased pain, increased swelling, increased redness, and increased warmth. All of those are expected, and yet all of those are indicators of a blood clot. So patients will often say, how would I know the difference? The difference typically is the blood clot would be a sudden onset. It is red. It does not change color like normal bruising will change colors. The blood clot is typically either in your thigh or your calf area, and it will not change. It will not change if you walk, if you ice, if you elevate, if you take your pain meds. It does not change. So if you have those symptoms, I would encourage you to call Central Maine Orthopedics, share with your surgeon. If he is concerned that it could possibly be a blood clot, he will send an order for an ultrasound to the closest hospital where you live. You will have a date and a time to go in and have the ultrasound done, and the results go right back to your surgeon. And then if it was negative, he will call and say, just keep doing what you're doing, it's normal. If it is a blood clot, he will take you off the medication that we were using to prevent a blood clot, and he will put you on a medication to treat the blood clot. So it's not a 911 emergency, but it is something that you need to have addressed. If you ever had chest pain or shortness of breath, anytime after any surgery or any day of the week, you always want to call 911 for those two symptoms. So the last thing that I will share with you is that your exercises are instructed by the physical therapist when you're here with us, and they're in the education binder. Some patients, when I call you at home and check up on you, will say, I'm not going to do my exercises because it hurts too much, it's too swollen, I'm going to wait until it feels more comfortable. So that actually slows down the healing, and your outcome is delayed. So even though we don't expect you to complete your exercises like you did with the physical therapist today, we still need you to do them. So your range of motion is going to decrease as the swelling increases. So it makes sense that today, when you've had surgery, the swelling hasn't had a chance to come into your body yet. So your range of motion was good today. So you go home tomorrow, the next day the swelling increases. So what you're able to do now is more like this. So expect that your range of motion is going to decrease, but just simply doing the exercises and using those muscles around your new joint is going to actually decrease the swelling, which in turn is going to decrease your risk for infection and decrease pain. So please keep doing your exercises. It's not uncommon for you to not be able to do all of the exercises. One common theme seems to be for the total knee and the total hip patients, patients aren't able to do a straight leg lift when they get home. And again, I'm going to encourage you to keep trying to do this. It's muscle memory. If you have a coach that can take your heel and just slowly lift your leg up and down while you're thinking that you're doing it, that actually helps your brain and your muscle connect faster, and before you know it, you'll be doing it on your own again. So please know that if you have any questions, any concerns, that your surgeons want to hear from you. And again, you can call Central Maine Orthopedics 24 hours a day, 7 days a week at 783-1328. Thank you and have a great recovery.